Chapter 3. Supporting employment through health and high-quality care for all. From the responses we have received after the Green Paper, we are focusing our work on the vital role of prevention, creating the right environment to join up work and health, increasing services and testing new models for mental health and musculoskeletal services, reforming the Fit Note, developing the occupational health offer, the role of prevention. What we heard in the consultation. Most people thought that the government should focus on preventing illness and that early access to healthcare would stop people falling out of work. Making sure all employees feel able to talk about health and work issues is important to a prevention approach. The consultation responses suggested the government should help this to happen through regulation, financial support, training and guidance. What we are doing. Action to keep people healthy is important to our public health system and NHS England's 5-year forward view. We are working with Public Health England and others to introduce a programme of work relating to this, including building the evidence base, producing a suite of employer toolkits, and making better local data more easily available. Creating the right environment to join up work and health. When people visit their doctor or other healthcare professional, we want more of these health staff to talk to their patients about work and how it affects health. We want people to know that good work is generally good for health. This includes talking about when it is possible to go back to work if they are out of work, what can be done to help them get there, and how to manage their condition while in work. This is part of our work to look at what people can do at work instead of what they can't do, and finding solutions to help people live their lives better. This includes helping them to work and stay well in work. What we heard in the consultation. People said that they would like healthcare professionals, employers, and Job Centre Plus professionals to be better linked up. Most people felt that data sharing between each area could improve services. People also often thought that better joined-up services could have a positive effect on other wider social needs, like debt or housing problems. Most people agreed that it is important that everybody knows that work and health are linked, and that good work can have a good impact on health. People suggested that this could be done through guidance, asking services to be more ambitious, education and training, and broader culture change. People also felt that it is important that healthcare professionals know that work and health are linked, and that good work can lead to good health. What we are doing. We know that some healthcare professionals believe that good work often leads to good health. But we want this to be a more common belief promoted by more healthcare workers. Raising the profile of work as a health outcome with healthcare professionals. We are working with Public Health England to run a detailed survey of health professionals. This will help us to understand what health professionals think about work and health. We will also appoint a GP champion to tell other healthcare professionals that good work can help support good health. Practical learning and tools, and learning to support healthcare professionals. We asked Public Health England and Health Education England to deliver online learning for the common causes of work-related illness. We are also doubling the number of work and health champions. Improving provision and testing new models for mental health and musculoskeletal services. We believe everybody who experiences mental health conditions or musculoskeletal conditions should receive timely access to services. We also believe these services should, if appropriate, focus on helping these people stay or get into work. What we heard in consultation. People wanted better and more even distribution of services across the country. People also wanted to be involved in the design of services, and they wanted these designs to be aware of local needs. What we are doing. We are also committed to expanding mental health services. The NHS will establish 21,000 posts and employ 19,000 additional members of staff by 2020. We are also working with others to develop a 5-year plan to improve mental health services. Through our plan, the NHS 5-year forward view, the government wants an extra 1 million people to have access to mental health services by 2020-2021. Testing different models for joining up health and employment support. We are running different trials across the country to decide what is the best way to join up health and employment support. We are also more than doubling the number of employment advisors in mental health talking therapies to help more people stay in or find work. The Department of Communities and Local Government are also leading a trial called Mental Health Trailblazers, which will look to see if employment advisors in mental health therapies improves the likelihood of somebody entering work. For musculoskeletal conditions, we want to keep learning to find out what works best. We are working with Arthritis Research UK to create a data advisory group. We will commission research to investigate musculoskeletal healthcare provision. In addition, NHS England are working to create a national knowledge hub for musculoskeletal conditions, and a skill set and framework for use by healthcare professionals. Reform of the Fit Note. We want the Fit Note to focus on what people can do, not what they can't do. What we heard in consultation. When we asked people what they thought, many people thought that the Fit Note could be changed to become more detailed. There was mixed responses as to who should fill in a Fit Note. Many people suggested that GPs are the right people to fill in Fit Notes. Other people thought that other healthcare professionals could also fill in a Fit Note well. Everyone agreed that healthcare professionals need better training on occupational health issues. What we are doing. We have already completed an internal review of the Fit Note, and we have a number of things we want to change about it. We will start work to change legislation, to change the Fit Note so that more people, other than GPs, can fill it in. We will look at the Allied Health Professionals Fitness for Work report to see if it can be used to support people to remain in or return to work, and whether it can be used instead of, or as well as, the Fit Note. We will also build Fit Note training into courses for people who are training to become healthcare professionals. Developing the occupational health offer. We want everybody to be able to access occupational health services, as it is important to helping people enter and stay in work. What we heard in consultation. We received widespread support for the vision we outlined in the Green Paper. People said that the current model of occupational health does not meet people's needs. While large companies often provide employees with access to occupational health services, small and medium-sized businesses often do not. There is also a clear lack of conversation between many different professionals. What we are doing. By the financial year 2019-2020, we want to have a clear vision for improving occupational health. We will appoint an expert working group to help us. We have commissioned research on occupational health and are working with a range of partners to run trials. We are working with Greater Manchester and the Scottish Government to test how to best join together health and welfare at a local level. We are going to test integrating occupational health into primary care pathways. We will then look at building occupational health into secondary care pathways. Chapter 4. Working together. To achieve real change, we need to work with lots of people in lots of different settings. Working with local partners. We know that local people often know their local issues better than we do. So it is important we work with them to achieve the best results possible. We want to help local people lead the way and deliver change. We are also looking at local data, and we are working with Public Health England. Working across government. We want to work across government to create a joined-up approach to better help everyone. We are working with the Department for Education and NHS England to better support young people with health conditions or disabilities. The Department of Health and the Department for Education are working on a green paper on children's and young people's mental health, and this will set out new ways to support and promote good mental health and help those experiencing difficulties to get help quickly. We are also working with the Department of Business, Energy and Industrial Strategy to make sure we improve the chances for disabled people and people with health conditions to get into work and to stay in work. We are also working with the Department for Transport on their Accessibility Action Plan to improve the travel experience for disabled people and people with long-term health conditions. We are also looking at the Department for Communities and local government-led mental health trailblazers to decide whether supported employment alongside NHS talking therapies improves employment outcomes. Working with other parts of government. We know that we will only achieve the best if we work together. We are working closely with NHS England, Public Health England, NHS Digital and Health Education England to build information and share data. NHS England. We are working with NHS England to show musculoskeletal care across the United Kingdom. With the Department for Communities and Local Government and NHS England, we are doubling the number of employment advisors in mental health talking therapies. Public Health England. We are working with Public Health England on a number of plans aimed at mental health and musculoskeletal conditions. Health and Safety Executive. The Health and Safety Executive, HSE, plays a key role in making workplace health and well-being possible. The HSE's new Health and Work programme and Go Home Healthy campaign wants to tackle work-related stress and musculoskeletal disorders, as well as lung disease. HSE is working with industry sectors and the wider health and safety community to bring change through advice, guidance, and tools that enable employers to support and guide their employees. Devolved administrations. Some of the things discussed are devolved in Scotland and Wales, as well as in Northern Ireland. The government is committed to working with devolved administrations and local areas to make sure everything works the best it can and that we achieve the change we want to see.